Now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. Today, April 7th, is World Health Day. The theme this year is Our Planet, Our Health. The organisers say they hope the theme directs worldwide attention toward the well-being of our planet and the humans living on it.
The World Health Organization proclaimed the 7th of April of every year as World Health Day, with different annual themes focusing on the currently prevailing health matters requiring immediate attention. And the spotlight this year, of course, is on the COVID-19 pandemic. For more, we connect with Ben Cowling, Chair Professor of Epidemiology at the University of Hong Kong. A very warm welcome to you, Professor. And, well, firstly, I'd like to get your take on World Health Day as someone who is in the field of medicine. So what does it mean to you, and does it raise much awareness about the various ailments facing the world?
I think the last 2 years have raised everybody's awareness about health because of COVID. Right now, I don't think we need more awareness of COVID. But maybe one thing we can think about is what are the longer term consequences of the pandemic, not only in terms of long COVID, but also in terms of the disruption to people with other conditions, heart disease, cancer, diabetes, etc., who may now suffer more because of that disruption to their care in the past 2 years. So I think that's something to be mindful of today.
And the COVID-19 pandemic really highlighted to everyone how disjointed and unorganized the response to the pandemic was at the very outset. There were a number of reasons for this, of course. But do you think there is enough planning happening now to ensure that when the next pandemic comes along, the world will be able to deal with it much better?
I think very soon it will be time to reflect on what's happened during the COVID pandemic, what the early response was like, what the response throughout was like, and learn the lessons. In Korea, I think you did pretty well, I have to say. You held off the virus for 2 years, you got the vaccines in, you got the vaccine coverage up. Now you have a lot of cases, but you don't have so many severe cases. It's a pretty good job. There's still lessons to be learned, and I'm sure that we'll reflect, we'll assess, and then we'll make better plans to deal with the next pandemic. And that's true for Korea, it's true for everywhere else in the world.
And Professor Cowling, the WHO estimates that there are around 30 million deaths that happen around the world each year due to avoidable environmental causes. Well, there's not much we can do to actually physically remove ourselves entirely from these environments, but is there anything that people can do to help keep their health in check?
Well, each of us can do things to improve the environment around us. We can use less energy. We can use less plastics, for example. We can improve our own living environments. We can also think about the bigger picture in global health in other parts of the world where they're maybe not as well off as we are. So there are things that we can do, but it's not going to be easy, that's for sure.
And finally, we talked about this a bit before with our COVID-19 reporter, how according to the figures available to us now, cases generally seem to be on the decline around the world. Some people are saying the rampant spread of Omicron may have played a part in that. Do you think we are approaching the tail end of this pandemic? And perhaps could I press you for a timeline of when you think we might be out the other side?
Well, from your report just now, it sounds like in Korea there's really a push to get back to normal very soon. And that, to me, would signal the end of the pandemic as far as Korea is concerned. It doesn't mean COVID's going away. COVID will still be around. It will still come back. The next variant, there'll be a surge in cases again, potentially a threat to the hospitals. We got to keep reminding older people, particularly, to get vaccinated, make sure that hospitals are prepared if there is a surge. But I think the next few months, we're going to see most of the world returning to normal. There may even be a race to return to normal because of the economic advantages of doing that more quickly. And as you mentioned, Korea is reopening for additional flights, and other places are as well.
Well, Professor Cowling, it's always a pleasure and privilege to speak with you. Hopefully we'll get to connect again soon. Thank you.